This week, the Wild team travelled down to Egham in Surrey to a swan sanctuary to meet Dot Beeson and a host of dedicated swan rescuers. Feathers flew, people got fouled and a swan lost its wing, all in the name of caring for Britain's wild birds.
All right. Okay.
Ruffled.
A little bit of a
ruckus.
Right, darling.
Put them in here. Because swans are territorial, aren't they, Dot? So
Not in this sort of situation normally.
Right.
Let me just see if I can find a towel to... Tim, you couldn't get me a towel, could you?
Towel?
Please.
But at this time of year, they're out on the fields. Look at you. It must. That's
Well, it's the first time it's ever happened to me.
Oh. I don't believe that.
This is my goose lake.
Well, they don't know that, so
No.
they just go where they like.
That's right.
They don't know that's the goose.
Oh, thank you, Tim. Thank you.
Dorothy, you've got these 3 acres here, and you've got these lakes, and you made these lakes, did you?
Yeah.
You had them created. And how did it come about then? This because there's a story, isn't there, behind?
Well, you know, I started off. I lived in a nice little semi.
Yeah.
With quite a large garden, and I was taking in 300-400 a year patients, and came to a stage where I really had to decide whether I wanted to carry on and expand, or or cease. The council leased me this piece of land, and so I set about.
So you sold your house, you put all your stuff, your money together, and you bought this place.
Yeah,
and where
you know,
did you
things
live?
like- I live in that caravan.
You live now in that caravan.
I have done for the last 13 years.
13 years. You've sold your house and you live in a caravan for the swans.
Yes.
What made you do it?
It had to be done. They were so under threat, I think, as a species. I mean, I know now that you see plenty of swans about.
But at the time when
to
you
be done.
started to do this, the swan was really declining and you really felt needed your help.
There was virtually no swans left on the Thames at all. And every swan that I came across was really
Injured or
dire,
had lead
problems, yeah, all
somewhere.
sorts of things. They really were, and we would have seen them probably completely wiped out by about 86, 87, 1986, 87.
Except that the lot of the campaigning and pressure on to change the lead situation.
Yes, and in 1987 that came about, yeah.
Hi.
What's happened here?
Well, I think he might have had a hook in his neck and he's got a broken leg.
Both?
Yeah, I think so. There's a lump there, Doc. Can you feel it?
You seem very jolly
Little
about
scab.
this, Max. You've done this many times before, have you?
Frequently.
Frequently done this. And,
Yeah.
and
Oh, hey, baby,
I won't touch him.
Come on,
'cause I
come
don't want
on,
to add to
come on.
his distress. But
Come on. It's easy.
how did you hear about him? Where did
I
you
got a
find
report about him yesterday and I went down this morning and I spent about an hour and a half convincing him to come out the water to see me.
him? What are the chances if he's got a broken leg of him? They'll fix it.
Yeah.
You seem very confident about that.
I never lose it.
They'll fix it.
Never lose it.
Have you seen him standing?
Yes, he can't.
So you're feeling along the leg. That's the broken leg, is it?
Yes.
What are you feeling for?
Feeling to see if I can feel any broken bones. I'm feeling right up to the hip.
And how did he look in the wild, Max? Was he was very lame, was he?
Yeah, totally lame. He's standing on one leg. He can't walk on it at all.
Can't walk on
No.
it, okay.
No.
But when you found him, he was on the water.
I had a report he was on the land yesterday, so I went down this morning early. And he was on the water this morning, but I managed to make him come out. Then I got behind him so he couldn't get back in.
It's broken here. It was quite an old break because you can see the skin wound there is healing.
So
And there's a little break there as well in the skin. So what would
you think that the bone may have come through and then actually got
yes,
back in?
that's
Okay.
right. We'll let him settle down a bit, and then we'll have him back in, and we'll put some support dressing on there.
I'll put him in a pen next door, yeah?
Thanks very much, Max.
And he is remarkably calm, isn't he?
Yeah, he's a good boy.
Yeah.
Just chuck that lot outside the door in a second and I'll wash it all.
So you're confident about him?
Yes, they generally mend quite nicely, but it just takes a little bit of time.
This was all very run-of-the-mill for you, wasn't it?
Yes.
You know, we were just about to do one operation.
Yes.
Which is quite, I mean, when we heard about it, you know, on the phone, it's quite a major thing, a wing amputation.
Yes.
And we'll talk about that in a minute, but
Yeah.
then we were just about to do that, and then this other Canada Goose comes in, and he's been,
Yeah.
but to you, that's just normal.
No, they come in and they get settled down, and they're doing this almost 24 hours a day. So
4,000 birds a year.
yeah, yeah. They just come in, and people will ring them up any time from 6 o'clock in the morning to 11 o'clock at night, and halfway through the night. And some people have been out during the day, and they're worried about a bird, so they'll ring us when they get home. So then somebody will have to go out and get the bird. When you can't go out and look for them in the dark, so you'd have to wait for the next morning and go and look for them.
And that's
bring
what
them
Max
back
has
in.
been doing this morning.
Yes.
Well, we don't want to delay your operation,
Right.
or scheduled operation,
We'll
so
get on
let's,
with that.
yeah.
Go and find some more towels to put on the table.
Run of the mill. What are you doing with that, Max?
I'm just giving it to this little goose.
Oh, to the new goose.
Yes, it's bread and water and
Look at
corn
that.
and wheat.
He's cross with you, but he just...
And then I put his nose in like that, then his nose is there.
Oh,
You're not
right.
supposed to fight like that, so I hope you weren't filming it.
Well, we weren't for it, but presumably, Max, that's also run of the mill round here. It's a bit of a scrap with a goose. But what did you do? You
I
shoved
just
his nose
put his
in.
nose in it, so he knows it's there.
So he knows what he's... Does he know it's there? Look, he's watching us. Come on, eat your grub.
That wasn't the one on my lap earlier.
Okay, give me an, just going to give me an apron. Right.
You can put one of those on some your belly getting there.
Now, some of your swans, that, including this one today, they end up disabled. They don't end up able to be released into the wild. And so, like you said, you put them on private
That's
property.
Right. Yes.
And you know that, and you've seen that they're actually able to raise their own young.
Oh yes, yes.
They sometimes pair up with a completely healthy swan. And
Yes,
raise
they
them,
do.
Continue to...
Doesn't seem to make any difference, apart from the fact, of course, they can't take off. But providing we've been careful enough to choose the right habitat.
Now, what happens about when they're babies? I'm intrigued. They've got their babies, and their babies are able-bodied and fine. How do they learn to fly and do those things? They go with the other one of the pair, do
both
they?
parents take part in the lessons, but of course
They give them
the
flying
one winger,
lessons.
the one winger flaps up and down with one wing.
Sort of egging the others on.
Yeah. And we've never had a problem yet because we've got a disabled parent.
And what happens when you've got migratory? Do you ever deal with migratory species like the Buick swan? Or
Yes, what usually happens is they've flown in from, say, Finland or wherever they've come from, and they hit pylons in the Yorkshire area, and so end up here, and, you know.
And that's what's happened to... Does he have a name? Or does
This
he...
patient here now, this little female,
Okay.
she's, you know, she's absolutely smashed her
Should we
wing to
just have a look at
smithereens.
her? Should we come over here?
Yeah, she's quite...
So- She's got this green bandage round her wing at the moment.
Yes, and it was a pressure bandage, really, because when she came in, she was very, very shocked. And unfortunately, when they've hit a pylon, you need to leave it for at least 24 hours in most cases, because there could be internal injuries, you know, the spleen could be ruptured or something like that.
Okay, now she's flown into a pylon. Now pylons are a bit of a bugbear for you,
I
aren't
just
they? You're a
absolutely
bit cross.
hate pylons because, you know, they are something that the electricity companies could really do something about and make a difference to the environment for these creatures and for all flying creatures.
Okay, because you're flying
And of
along
course they
with a swan,
don't. Yeah.
and you can't see the wires. They're thin.
All I can say to you is I don't know if you've ever gone to put washing on one of those rotating clotheslines,
Right.
and sometimes you just miss that first one,
Right.
you know, because you're so close to it or
And you bash
whatever, yeah, and you hit yourself. Well, I mean, she's lucky because it's only broken her wing, but for some, you know, they hit the ground, break their neck, and...
But her story could be completely different if you had...
That's right. I mean, look at that little chap over there. I mean, he had his off 2 days ago. See his baby?
He's had his wing removed.
Yeah, he's had his wing removed.
Okay.
Now,
The bottom half of his wing.
you were just seeing an ordinary average week. That's 3 in 3 days. What was
3 in 3 days. So you treat
Yeah.
4,000 swans a year. Is that right? 4,000 animals a year. Of those, how many do you reckon are
About a
pylon?
third. Yeah,
A third.
Yeah, must be.
So that's a lot of birds.
And that's all birds that we have to find homes for.
So, what's your message?
Well, I mean, I've been saying it for years and years and years, but I wish to God that these electricity companies would do something. I mean, it would make such a difference if during their routine cleaning they would actually put these big fluorescent markers on, and I'm sure we would see a reduction in no time at all of our casualties.
So, what you want is those big orange balls which we
That's
sometimes
right.
see in electricity cables.
Very few places, yeah.
You want to see those on all...
Everywhere, full stop.
Little fella.
This little fella here is really very poorly. He's actually lead poisoned, and he's gone on to the second stage of his treatments today, or is about to.
Now, lead, you were telling me lead. I mean, it's one of the sort of things we associate. I guess it's one area where the press has been successful in getting a message out there about.
That's right, but I mean that message was, you know, it reached its peak in 1987. We're talking about a lot of years ago, and at that stage, I would say 95% of all the swans I treated had some lead problem or other. Nowadays, it is rare to see a lead poisoned swan.
So the problem with lead is that swans swallow the lead weights used by anglers, and they use them in their gizzards.
That's right.
To grind up the food.
That's
and
right.
the problem was that the lead weights were exactly the right size stone, because they selectively pick out stones, don't they? But what's happened now?
As I say, it's a very rare occurrence.
Because we've changed the size of the lead weight.
Because fishermen don't really use lead, nowhere near
as much.
You know, as much.
Yeah. So this bird's been a bit unlucky. It's
been a bit unlucky, yes.
Foraging in an area where there's a lot of lead.
The thing is, people always used to assume that if a swan had a high blood lead level, that meant it was lead poisoned. But in actual fact, you see many very healthy swans with quite high blood lead levels, with no other clinical symptoms.
In part 2, we go into the operating theatre with Sally the vet and our injured swan, and we attend a not so dramatic swan rescue. Finished the operation, we're having a look round. They got a call in at the Swan Sanctuary, and a swan's in trouble on the river, a cygnet, and we've come up with Sarah, who's a volunteer, full-time volunteer at the moment,
yes.
At the centre, and we've come up, we're going to have a look for it, but apparently it's sort of wandered off from where it was before, isn't it? So
yeah, not too sure where it is at the moment, so just going to have a little look around and speak to the original caller and see if we can find it.
Okay, let's go.
Yes, copy of one.
Well, we found what we think is the cygnet. Do we know for sure? We don't know for sure that this is the one they phoned up.
No, we're not sure. It looks like the only one on this stretch of water though.
This is the closest one to...
Yeah, and there is actually, it looks like an adult pair down the bottom. It's actually just gone out of sight now, so...
Now this one, to me, this cygnet, it's the first year, is he? Born last year?
Yeah, he would have been born last summer.
He looks completely fine to me, Sarah.
He looks okay, doesn't he? He likes to sort of get a closer look, really.
Yeah. So you're throwing in some bread there to entice him over?
Try and entice him over, but he's not interested at the minute.
Yeah. Come on.
Come on, sweetheart.
Might he be scared of the camera? Do you think Scott should back off?
Really, no. I think if we try and move up a little bit closer to him so he doesn't come so far.
You found it, did you?
The member of the public reported it to us.
And said that he wasn't walking too well?
No.
So, and have you seen him?
I've seen him, but he seems to limp a bit, you know.
Yeah, doesn't look too healthy.
No.
You working down here, you're working for British Waterways down
yes.
here?
Did he see him out the water? No.
He was on land.
He was on the land.
We've come away so that the swan goes to Sarah, because we thought it might be fine with us, but actually he's making his way over here now.
Yeah, unfortunately there's not really a lot we can do. He's very scared, he's very wary. I don't know what's happened. Normally a bit of bread and they come over. But he did get quite close to us and I'm quite happy with the leg. He hasn't been reported to be not able to stand on it or use it. And he's got it tucked up out of the way, so...
You're going to keep an eye on him?
Yeah, I'll have a chat with the lady. She's very good down here and I'll ask her to keep an eye. And if it gets any worse or any other problems, I'll get her to give us a ring and we'll come straight back down.
Okay, so it's back to the centre of the next
Yeah,
one.
go back.
It wasn't the most dramatic animal rescue ever, but it's the kind of frustrating experience that happens every day when you're trying to help wild animals. Back at the sanctuary, we had attended an amputation of a swan's badly shattered wing. Yeah.
That's the anaesthetic going in, so
Okay, now
it
he's
takes
going
about
to
10-20 seconds.
This looks great.
It's popping a tube down the windpipe so it can take some gaseous anaesthetic.
Okay, so you're going to pluck out some feathers and then you're going to saw off
Yes.
at the shoulder.
No, below the shoulder. This is just above the elbow.
Okay.
We need to prepare the site and go in surgically.
So how long can you keep the swan under anaesthetic now?
Well, as long as we need to, but obviously the quicker the better. Like with any operation, there's always a risk.
Yeah.
And we don't know what other injuries he may have internally, so because he's fallen a long way. So we like to get it done nice and quickly so that we can get him awake and get back on his feet talking to his friends.
So this gives me a clear area where I'm going to make an incision around there. And this is actually intact bone, but you don't want to do the operation in that infected bone because it will leave an infection in the wound, in the remaining bit. So we need to take it right up here. That little wound isn't going to affect the operation, but just take it right up there. That's what we call the leading edge. Now we're just going to cut some skin.
You just rather nonchalantly cut through the
Yes.
leading edge of the wing there.
But it's
Sally.
clamped off.
Which means that the blood is stopped
Yes,
from
that's right.
travelling that way, okay, into the wing.
But you can see even up here, this is more normal, but it's even bruised up there, so it's quite a lot of damage to the wing.
And do you think this was causing the bird a lot of discomfort, a lot of pain?
Yes, you find with wild animals it's actually quite difficult to assess pain as you would in a pet cat or dog, because when they show signs of pain and weakness in the wild, that's when some predator will come along and eat them. So they have to look as normal as possible,
as perky as possible.
One can be fooled into thinking that they are perky when they're actually very poorly.
Yeah.
Right, that's the skin out the way.
Will that string stay in the bird?
This dissolves, so it will stay long enough to do its job, and then the body will just dissolve it away over a couple of weeks or so.
So the body will heal off that?
That's right, and it'll just become a blind ending pipe. It's like capping off a pipe when you're doing a bit of plumbing, really.
Right.
You start feeling hungry as soon as we've had our brown flakes in the morning.
We
That's the
do,
trouble. By this time we're usually talking about what we're going to have for lunch.
And this is what, over the upper wing?
Yes.
Oh, yeah.
It's a little muscle.
Now swans aren't supposed to be able to fly, are they? They've got such high loading, they're so heavy.
That's right.
To their wings. They're one of the, are they the largest flying birds?
They are the largest flying bird. They're usually, the average body weight of a adult swan's about 10 kilos.
So if you work it out sort of aerodynamically,
I'm sure, yes.
Not supposed to be able to fly like bumblebees.
Yes.
And one of the consequences of that is that they're not brilliantly manoeuvrable, are they?
No, they're really not very good at flying.
And the other thing that happens to swans is that they'll be flying over an area and they'll see a road, a wet road, and think that it's a river.
I think that the reflection is the river, and with railway lines as well.
And they'll come down, land on that, and obviously get big internal damage.
Yeah.
Okay. And that's what's obviously that's what's happened to this chap. He's come across a pylon and not been able to stop in time or change direction.
That's right. And just crashed.
They're a bit like the big sort of very big ships, aren't they? That sort of take a mile to slow down.
Yes.
And then once you've got yourself going, they
yes.
take a long time to get off
Yeah.
the ground. You see them, don't they? They look spectacular doing that running along the water to take
Yes,
off.
they do need a big run up, and that's why we can keep them in outside pens that are only maybe 10 metres across, and then we know that they can't fly away from there. Right, I'm just cleared the bone now. Just going
right,
to.
so this is what we've got the bone exposed.
Yes.
And now you're going to saw through the bone.
Yeah.
Okay, this one here. Okay, right. Listening to his heart, are you?
Yep.
Can I have a listen?
Yeah, that's it.
What am I?
Here.
A thudding sound.
Boom, 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 boom,
That's it.
boom. That's right, is it? That's a good pace.
That's not
It's a bit slow,
Slow,
but
slow, but we'll do it.
What would it be when the swan was awake?
about 200, something like that.
Quick.
Well, one of the problems is they haven't got a lot of blood. If you had a mammal this size, you'd have lots more blood to lose.
It's a
but they
trade-off, is
haven't.
it? Because of
Yeah, so you've got to be careful not to let them bleed.
Oh, that's
too much.
interesting because you want to have. You don't want to have too much blood because you're flying.
Well,
and
that's
blood
right.
is heavy,
Yeah,
is that
that's right. And there's a lot of air in there that hasn't got any need for blood at all. There's just huge, great big air sacs in there full of air.
So where we might have tissue and blood, they've got air.
Yeah.
So that minimise the weight.
That's right.
Okay.
We have a lot of injuries, crash injuries in November when the juvenile swans are just taking their maiden flights.
Yeah.
And that's when a lot of the damage is done.
Never flown before and they have to learn
That's
that.
right, yeah.
So we know that this bird is young because it's got black. She has got black on her face rather than the orange that they get when they're mature. But how old do you think she is?
I should think she's about 2.5.
2.5.
Not very experienced yet.
So she's very young to be losing a wing, isn't she?
We have had younger.
Yeah. But they might live sort of 20 plus
Definitely.
years.
Yep.
If you leave it on, she'll only live another 2 days, so it's got to come off.
Sure. Yeah.
Okay, that's the wound there. That was the little hole there that was from the damage.
So that's it.
That's it. That's
You've
your
done it.
party.
Undo this ready to come out.
Gently massaging the body.
Yeah, it's just poking them
Stimulating them as the eyes
Make
are
them
open
wake
now.
up.
That's coming
Yeah.
out.
Get the blood flowing.
That's it. Just want to flick that switch up on you.
Oh, there she's coming around.
It's the same effect as a nurse patting your face and calling your name.
Oh, I'm afraid it's been a bit of a day for you. But you would have been much worse off without that. Yeah, I know.
So just
Oh,
coming
she's
through
gonna
the
be on
anaesthetic,
me.
yeah.
She's
Just
absolutely no idea what's happening to her, has she?
We can break it to her if you like.
yeah.
She'll find out by herself.
Okay, we're going to take her back to recovery room now.
Come on then, lovely. Come on. There's a good girl. Come on then. Come on.
Scott, this one's waking up. Yeah, I'll give that to me. Go on, just get in there. Are you resting your head on God? We can report that our swan is recovering well and will be released soon onto a private lake. If electricity companies would only show swans where their pylon lines are, however, all this could have been avoided.
I mean, people say to me, oh, you must have hardened over the years, but I haven't. I mean, when there's a particular bird that I spent a lot of time coaxing to recover, and it dies, you know, people think that I just accept it. But I mean, inside you're tearful. You're, you know, it's still sad. It still hurts. It's it's all sorts of things, really.
But there's all these hundreds of birds that are given a new lease of life because of your work.
Yeah, and I feel chuffed about that.
Yeah.
I feel chuffed that me and my team have made a difference. And I think that's what it's all about. Everybody's got to do what they can do. And, you know, I think that's why I was put on the planet. And
You're a swan woman.
well, about that.
You are. You clearly are. Come on then. Hooray!